This is Laura Tucco, certified legal nurse consultant, and Laura specializes in emergency cases. And so, Laura, I want to ask, I know there's a huge incidence of visits to the emergency department. Let's talk about that, because that's obviously what sets the stage for this being such a highly litigated area. So many people go to the ER.
That's right. There are many visits to the emergency room. 2013, when statistics were last available, there was over 130 million patient visits in the United States. And that's with a decreasing number of emergency rooms, because emergency rooms unfortunately have closed. But many patient visits, and the potential is going up and up from there.
Okay. And I know one of the big reasons that emergency departments are at risk legally is because to the patient coming in, they're often being treated by what we call in the legal world these anonymous providers that they don't have these long-standing relationships with. So when things do go wrong, they're very quick to sue. Whereas if somebody has visited their family practitioner and has an issue, they've seen that practitioner for 10 years, they might be a little more forgiving. You want to talk about that?
One of the things that contributes to a good outcome with patients is so basic, and that's the relationship that you have with the patient, and that's the major contributor to patient satisfaction, is that communication pattern. And when these patients come into the emergency room, they are being taken care of by people that don't know their history, don't know them, maybe have no access to their records, so it leaves a lot of potential problems in the care of that patient, and it creates possibility for many errors.
Yeah, so that can feel kind of vulnerable for the provider.
Absolutely,
yeah.
And the providers have to make split-second decisions. They're often caring for many patients at the same time. There are so many factors at play in the emergency room that it's really an area where you have multiple contributing factors oftentimes to cases.
I mean, an emergency nurse has to really be knowledgeable in so many areas because they're dealing with every type of emergency, right?
As I always say, you have to be a jack of all trades, master of none, because you have to know a little bit about everything and not a whole lot about anything. And really, patients are going to do well in an environment where they have very experienced staff. And so you will see, when I look at my cases, I look at how long have this person been a nurse that's taking care of them, how long have they worked in the emergency room, what kind of training that they have, because it is such a complex area that they are cared for very differently depending on the qualifications of the provider.
So when you're actually analyzing your cases, that's very important, and I'm glad you brought that up, that you're looking at the experience of the nurse who was implicated. Very good.
Right. Look at what is their license, how long have they been working in the department. Other things to look at is people that work in the emergency room often need additional training, ACLS, trauma courses. The Emergency Nursing Association has many, and so you look at when did they get additional training that is specific for emergency care, and are those credentials maintained, and who monitors that, and what does that department require them to have to work there.
And of course it can be a pretty chaotic place. The pace is fast. You want to talk about that? That kind of creates a setup for potential litigation and risk.
Right. You have care providers coming and going at all times of the day. Typically you have shift changes, 7 a.m., 11 a.m., 3 p.m., 7 p.m., 11 p.m. Your physicians may change shift at different times, so they're not all changing shift at the same time. You have patients coming in 24 hours a day. Those ERs never close, and you never find occupancy limits on the emergency room, so you can get unlimited numbers of patients, either ambulatory or versus ambulance arrivals. So very chaotic environment. Staff often work long hours. You have varying levels of qualifications to work in the emergency department, so many different factors at play, and you have varying acuity levels. So you have people that are not very ill all the way up to people that are in life-threatening condition. So you have to be very adaptable and, change very quickly to what is coming in the door.
So we know triage is obviously a big issue in these malpractice cases. What are some of the other big emergency issues that you see when you're consulting?
Most cases are not just one thing contributed to the bad outcome for the patient. Usually I find a whole constellation of problems, and it's not necessarily one negligent intentional act that occurred. It's many, many different things that come together to create a problem. So it can be nursing issues, it can be physician issues, there can be issues related to transferring the patient within the facility or to another facility. It can be issues of absolute error. Medication errors occur in the emergency room. It could be just the patient isn't being no one's recognizing, this patient is septic. They have a cough, they have a slight fever, they have a rash, they have diarrhea. It's a child. Nobody pays attention. They think it's just a sick kid, but in fact the child is septic. So you have atypical presentations, and that catches people off guard. Patients are moving at all times. You've got patients going to x-ray and back, and you have lots of stuff going on all at the same time. So many different factors contribute to bad outcomes for patients in the emergency room.
Okay, so the emergency department is such a different environment that I know I would definitely subcontract with an emergency specialist like yourself. But for anybody out there who is listening, can you just give them one tip? If they get an emergency case, other than to call someone like you, what should they do? Keep an open mind, look at all those records, and you may not have many records to look at, or you could have volumes of records to look at, but just because there aren't a lot of records there, and keep in mind, look at basic stuff, because it's often basic stuff that are important. Not adequately assessing the patient, not adequately monitoring the patient, and nobody is really putting all the pieces together to recognize, oh wow, this is what's going on. So nurses can do that, but for some of the nuances of the department, that was where your specialist should come in. All right, great advice. Thank you so much, Laura.
You're welcome.